Hello everyone and welcome to my presentation um, on lung cancer detection and outcome driven by the environmental, behavioral and healthcare related factor. This research uses a Tableau to visualize the key patterns and support the actionable insights. Let's explore how data can help fight one of the world's deadliest disease, that is a lung cancer. So the central research question for my study is what combination of environmental exposure, individual behavior and healthcare accessibility influences the lung cancer detection rates and the patient's outcome. My goal is to identify the strong predictors of late diagnosis and the poor outcomes and how the policy changes can target these areas of lung predictions. So to guide my analysis, I also posed the sub-research question, that is which risk factors such as smoking or pollution correlate with the worse outcome and how does the healthcare access affects the diagnosis stage. So this analysis is targeted to public health officials, policymakers and hospital administrators who can use these insights to reduce the cancer's mortality. So first let's dive into using Tableau. I have created the comprehensive storyboard with visualized narratives that reveals the trend hidden in the raw data. So I took the data of lung predictor direction. So each visualization that I showed in the five sheets answers a piece of my research question. Let's walk through them each by stage by stage. So this first chart demonstrates how the healthcare access impacts the when lung cancer is diagnosed. So that is named as the healthcare access versus the stage at diagnosis. So the key finding of this is um, I purposely I mean like unveils the effect of insurance and the screening access of cancer diagnosis stage using the healthcare stages at diagnosis. So the key finding is individuals with insurance screening access tends to the diagnosis at early stage, that is stage 1 and stage 2, which shows that patients in these diagnoses are early and the insurance access are very easily. So meanwhile, those without access typically reach the hospitals only at the stage 3 and stage 4. This emphasizes the life-saving role of accessible health care. So, and the goal I mentioned here is showing late stage diagnosis are common in poor access groups and the count of stage at diagnosis, which shows that the color showed detailed about the stages, that is first, second stage, third stage and fourth stage are mentioned in the different colors. The marks of count are also labeled in the each stage, that is 1,38,000, 92,000 and others as well. So let's dive into the second visualization. So here the second visualization shows the strong relationship between the age and mortality. So the mortality risk significantly increases in the patients aged 70 and above. So here we can see the mortality risk is increasing for the aged people after 70. So this highlights the needs for earlier intervention and regular screening in older adults. So show the older adult age equal to higher mortality risk. So next let's dive into the third sheet, that is here we can look at the distribution of lung cancer type, that is N NSCLC and SCLC, which means non-small cell lung cancer and small lung cancer, small cell lung cancer. So the non-small lung cancer accounts for 85% of cases consistent with global trends. Here we can see up to 85 percentage. So, and also this splits is important because the NSCLC and the small cell lung cancer, that is SCLC, respond differently to the treatments. So let's this visualization I had named as cancer type versus survival probability. So we can see that the cancer type and the survival probability, as I mentioned, for the 5 years. So next let's dive into the behavior. This chart explores the impacts of behavior according to the consumers, like smoking, alcohol use, and how the lung cancer occurrence according to the behavior. The smoking emerges as the most significant behavior risk factor. So we can see here that is 1,52,997. So excessive alcohol use and the second-hand smoke also contribute lesser extent. So these finding underscores the value of public health campaigns and the behavioral change programs. So this visually shows the how individual behavior are associated with the lung cancer diagnosis, which is yes or no. The color shows the lung cancer predicted, uh, which is like how the lung cancer predicted. This is the data color shown, like the data name is lung cancer predicted clean.csv is the data name I mentioned. So each color represents how the marks labeled by the count for the each smoking status. So let's dive into the global distribution map. So finally, this global heat map shows the lung cancer. So this map shows the lung cancer incidence by country. The nation with high pollution, heavy smoking and the low healthcare access shows the higher prediction rate. And also this helps prioritize the areas for international aid policy reforms. Here we can see what are the predictor countries with the no prediction and high prediction with the count of final predictions. So let's dive into the statistical summary support. This dashboard. Here I created the dashboard, the statistical summaries. These visuals, average patient age by 60 years. Here we can see our average percentage age. And the mortality and the survival rates were symmetrically distributed around 0.5, showing the balanced outcome across the samples. So among the categorical variables, the NSLC was 85 percentage, smoking status was fairly balanced, and only 50 percentage had the good health access. Uh, this shows the provide deeper context to our visual analysis. And this mortality, we can apply the filter as well here. As per the filter, the age group also will be classified. So next let's dive into my storyboard. The findings and pattern. Our findings totally from the dashboard and others, it shows that smoking and air pollution are the top risk factors for the lung cancer. Old age increases the mortality risk, and the lack of healthcare access leads to the late diagnosis, worsens the outcomes. The implications are clear. We must improve the healthcare access and reduce the environmental and the behavioral risk. So based on the data, here there are two recommendations, that is expand the affordability screening, mobile clinics and global backed service must be reach the high risk and low income pollution, and intensify the anti-smoking campaigns, that is program targeting the smoking behavior especially among youth and risk can be driven the long term. reduction in lung cancer cases. So, as these recommendations are grounded into the strong data, the smoking directly correlates with poor prognosis and the mortality rises sharply with the pollution and age. The highest survival outcomes were linked to the early diagnosis, tied closely to the healthcare access. So, as in the summary, this project demonstrates that lung cancer outcomes are strongly influenced by the trio of factors, that is smoking, pollution, and poor healthcare access, which targeted the behavioral change programs, and the environmental reforms are essential to save the lives and reducing the disparities. So I encourage the healthcare leaders to consider these findings when planning the future policies. And thank you for the watching my presentation, and I hope this presentation provide the insights into how data storytelling can help shape a healthier future. Please check the video link in the description for the final slide to access the Tableau story presentation on YouTube. Thank you for this opportunity. Thank you.